Dr. Quinn, thank you so much for joining us. Well, earlier you shared a very negative recent experience of a family member's child. Tell us what happened.
Well, basically, over the holidays, I had a conversation with one of my family members, and she shared a very discouraging experience that she and her daughter had when visiting their pediatrician. Her daughter is 14 years old, but she's a young lady that's living with being overweight, living with obesity. They went to visit the pediatrician, and basically, in the waiting room, there were no chairs that could accommodate her daughter's overweight status. What the receptionist was very discouraging and yelled out that she and her daughter could just stand up until somebody could get them back. And other people in the waiting room heard her, and a couple of other young teenagers laughed at her. She was very discouraged, but when she got to the back, they checked her weight, and the nurse yelled out her weight so that other people could hear it. Another discouraging experience. But then when they got in the exam room, when she was asked to put on a gown, none of the gowns fit. They gave her 2 paper gowns and asked her to drape one across the front and one across the back. But to make it worse, when the doctor got in the room, the doctor looked at the patient, a 14-year-old young lady, and told her, if you don't lose weight, you won't get a boyfriend. You won't have any friends, and you'll do terrible in school. And my family member got so discouraged, and the young lady was crying, and she said, just put your clothes on, and they left. What she told me was they were never going back to any doctor ever again.
Oh my goodness, that would be hurtful. How could it be hurtful medically and even psychologically to a patient, including patients who are children?
Well, I'm doing my credentialing right now to be board certified in weight loss medicine, and I'm studying a lot of research. And this occurs more often than you would think. I mean, this is more common, and it's terrible. But basically, the research is showing overwhelmingly when a patient experiences this, especially a child, there's less of a chance that that patient will return for medical care, resulting in maybe this person having high blood pressure, diabetes, which is more prevalent in someone that's overweight, being undiagnosed and untreated, resulting in that person having a heart attack or a stroke, or even a child not going to the doctor for the fear of being, looked at in a negative way and not getting screened for vision. Maybe they can't see as well, maybe they can't hear, or ADHD, or other problems that are picked up during a physical, and the child having problems in school. And also note that the research is overwhelmingly demonstrating when people go through this, adults and children, there's discouragement, but also anxiety associated, where someone will leave the doctor's office and be so upset, they'll be more likely to eat things that are unhealthy and exercise because they'll feel discouraged and in some cases depressed. That's why we have to really educate our medical community so we can get out of that and do better.
Yeah, and so what else can be done, Dr. Quinn? I mean, you just talked about education aspect.
Well, basically, like I said, we have to educate ourselves in the medical community and understand that we have to withhold our purpose, which is to help people and not hurt them. And discriminating against people, treating them bad, it hurts them. It makes them discouraged, and we shouldn't treat them that way. And we have to just understand that we have to make those changes and take that responsibility so we can continue to be advocates for our patients.
Mm-hmm. I can tell you're really passionate about this. Thank you so much for shedding light on this topic. And this is something we should definitely talk about again. We'll be right back.